Thank you, Mason. So I'm told that lunch will begin around 12:30, and I have the option of trying to manage the Q&A and making sure that we get to lunch on a timely basis, and then of course starting the next session at 1 p.m. So I'd like to suggest that maybe we can cut the Q&A a little shorter, maybe 10-15 minutes, and so this will give us maybe 15 minutes, 20 minutes for lunch. That's okay. Apologies. But I'd like to just want to capture the questions and the comments while the ideas are still fresh in our heads. So maybe we can start with the panelists. Maybe you have comments about each other's presentation or some of the themes that emerge in presentations?
Who do you want?
Anyone, please. Okay, then maybe I'll throw something out. It seems like inequality is a theme that's emerged in all the presentations and in various shapes of form. And obviously the panel discussion here is really about how do you allocate resources effectively and what is the cost of inaction. So given the diversity of challenges here, and going back to the point that Marie made this morning about disabilities, what are your thoughts about that? I mean, obviously heard Don said that in a lot of places we don't have data or information about the scope of the challenge and type of disabilities that we're dealing with. But I think Maureen also indicated that the very act of trying to collect those information would generate a need for services and need for response. So how do you suggest we tackle this issue?
Well, I really don't like being between you all and your lunch. It's a very difficult position to be in. But I would say that one of the issues when we present information is we're presenting information about the need, by and large. That's what we're talking about. Often, and I hope I highlighted that, often we don't know very much about what we're actually doing about it, that what countries are really doing, what's really happening to try and address those issues. So although we can, as Zulfi said at the beginning, one of the aims of this forum is to get a sense of the priorities for investment, what were the most cost-effective areas to invest in. We also need a much clearer idea of really what's going on in practice, what's already being done, and how practical is that. I think that's a piece that's generally missing from our understanding of the world.
Just to also build that, too often when we're looking at cost effectiveness, we're building upon studies which have been done in particular settings, and therefore particular assumptions about both the cost and the effect. And what I was trying to bring out is that both the impacts can be very different depending on the deficit, if you like, in the population. And with these new ways of thinking about delivery, the cost can be quite different from as well. So having that equity perspective is not just one of the human rights or the moral imperative, if you like. It can also have a profound impact on our calculations of both the cost and the impact of our intervention. So I think bringing that equality lens is important on many levels, but maybe one that's most underappreciated is on even our assumptions around both the cost effectiveness of our interventions. So I think we need to also shift from not just looking at the interventions themselves per se, but also looking at where and how they're delivered is an important part of our work as well.
Just a brief comment on Andy's question about inequality and how it is to be addressed. I think Mickey has some ideas that I'd like to hear more about. But basically, from my experience, there's a common tendency to underestimate the extent of inequality that exists in a society. It's been my experience that whenever you present the facts to people who live in a society about, let's say, just a range of outcomes in terms of survival, in terms of education, or the quality of education, increasingly they're surprised, and it's a spur to action. They just very often impressed. But beyond the sheer magnitude of inequality, there's also a conversation that is useful about the consequences of inequality. There's a tendency to assume that, well, we should worry about inequality for humanitarian reasons, which is good already, or to avoid the Arab Spring, which is also good. But there's more than that. There's a greater cost for society in terms of future economic growth and in terms of the quality of daily life. And it would be easier to mobilize the energies in the direction of containing inequality if these consequences of inequality are better documented and better discussed.
Okay. In terms of the allocation of resources, for example, in the Arab region, we desperately need to look into local data. So accordingly, the allocation of resources will be distributed. But local data is very important. We still rely on what the international community send us as a model, and we follow it. And sometimes it works, sometimes it doesn't. Local data is very important to follow.
Thank you. I'd like to open it now to forum members. I would just like to put in a plug for, I think the role of caregiver probably need to be discussed a little further as well. I think it'll feature in all the presentations here, and it may have some relevance in terms of how to address the inequality and allocation issue. So please go to the microphone closest to you in the aisle. And for this aisle over here, we have a...
I'll be brief. This was, again, a fabulous session. I want to pick up on two things that both, in fact, all of you alluded to this, but Don and Mickey referred to. The role of delivery platforms in addressing inequities. And one thing that we are beginning to see in that space around the RMNCH literature and field experience is that the prerequisite in those delivery platforms is, number one, how are you defining inequities? Now, most of us are looking at inequities currently through the lens of socioeconomic disparities, so asset quintiles. Whereas in many geographies, inequities may have different dimensions. To give you an example, we now have data from countries to say if you take a very different measure of poverty, such as the multidimensional poverty index, that it brings different social dimensions into account, and you map the same country for two different ways of measuring poverty. One is the bank's method of looking at assets and income and whatever have you, and you try and map the two, you find that they don't overlap. That there is close to around, in certain countries, a quarter of the population that's measured by one and not picked by the other. So I think it's very important in our targeting and in some of these delivery platforms to look at how we are measuring, recognizing, and documenting disparities. Disparities on the basis of geography, ethnicity, socially marginalized groups are typically never captured by SES indicators. They can be living right under your very nose amongst the urban populations and missed. So that's one important thing. But the good news in that is that many of the approaches, particularly these community platforms that have been developed, and I won't go into those details, some of the safety nets that we have, many strategies that look at integration of interventions with care providers, at the particularly community health workers, some of the stuff that Mickey has led around the role of child health days or community-based strategies for scaling up, they can reach those populations. And I think within the child development framework, particularly integrating health and education, we have a wonderful opportunity now bringing some of that science to bear on this. And doing that would be critical as we reach out to some of these populations that are currently unreached.
Thank you. There's been a greater and greater emphasis on the discussion of gender and gender empowerment, and in the particular region in the Middle East, there are various different interesting ethnic groups, which has made some remarkable progress. And Zeba Rasmussen, who's here in this room, has worked with the Aga Khan Foundation, as well in Gilgit and other areas, in reducing infant mortality and development through the introduction of lady healthcare workers for birth delivery. Given the fact that there is an increasing need for that gender empowerment and the issues in that particular region, what do you see as some of the barriers for greater adaptation of gender empowerment in the various different ethnic groups in the Middle East, especially with regard to child survival and greater emphasis on delay of marriage and the capabilities to bring these interventions to scale from the bottom up as opposed to the top down by the governments?
Hi, it's Albert Lee from Hong Kong. Thank you for the panelists for the excellent presentation. And I think Parfait raised an important issue is the rapid economic growth in Asia, especially eastern part of Asia. But however, the growth has been miracle, the economic growth. But I think in terms of health inequality and health inequity amongst the children in that part of the world is not narrowing. And it's not doing miracle. Should be on the improved economic growth. They should have a miracle achievement in decline of the closing the gap of health inequality inequity. But actually, I don't think we see this in that part of the world, the Asia Pacific region. And could it be, as Mickey mentioned, is the advancement of economic growth actually more dangerous, the richer group capturing more of the social benefit, or what Parfait was mentioning is actually eroding the extended family system, have an impact of the family structure, not conducive to healthy development of children. I always puzzle on the miracle achievement in economy, but on the other hand, even in the 21st century, we might not see the improvement, parallel improvement of the health inequality and inequity. Maybe the panelists could enlighten us further. Thank you.
Rebecca Stoltzfus, Cornell University. I want to make a comment that is a bit maybe more deeply philosophical and bridges the two panels. But I'm struck by the conversation about inequalities, which was fabulously framed by this panel, and that a lot of the graphics and the information that we saw that really struck us about inequalities were about things such as education, K through 12 education, or mortality, or specific morbidities like malaria, where there's very little, I would say, global debate anymore that these are really good things that we want everybody to have. And so we can measure, and they're measurable. So we can measure those globally agreed upon good things, and the inequalities pop out at us and knock us down. And then going back to the first panel and the questions about cultural relevance and do we really understand all the global goods of child development and how they're expressed around the world in various contexts. It feels to me that in our measurable, agreed upon global goods, we're missing huge swaths of what matters in terms of child development still, because we haven't had the fundamental conversation about how we look at child development using indicators that are broader and deeper than morbidity and mortality and education. And my thinking about this is shaped also by recently diving in again to the work of Martha Nussbaum and the human capabilities approach to development, and the way that she does such a marvelous job, in my opinion, of separating out human capabilities from human achievement. That what we want in development is to promote capabilities. What people achieve with those capabilities then depends on their own values and human agency and and unique expression. And I wonder whether we in this work shouldn't strive to reach that level for children, the capabilities. And to use a trivial example, you know, I do a lot of work in Zimbabwe. Zimbabwean children can sing. You, in any context, you say, let's sing, and they all sing. So using that particular form of achievement, they are so far ahead of American children. But I'm not sure that we would say that singing is an achievement where we want to make infographics about inequity. But it's a really important, deeply human cultural expression. So we might want to back up from singing and talk about the capability for artistic expression that underlies singing, that might express itself differently in different parts of the world. But I just want to, I think that the point of my comment is that I think that the human capabilities approach, which is gaining ground in development more broadly, might be really fruitful for us to look at in terms of children and child development and capabilities, and that in illustrating inequities right now, we are restricted to the lenses which we have defined for ourselves in terms of measurability and global consensus. And I'll stop there.
I think that's a signal for lunchtime. So unless there are other questions, enjoy lunch. And the next session will be moderated by Joan Lombardi from the Bernard Van Leer Foundation at 1 o'clock. Enjoy.